I'm Dr. John Kruse. I'm the author of Recognizing Adult ADHD, What Donald Trump Can Teach Us About Attention Deficit Disorder. And today I'm going to be talking about the importance of siesta time. Usually a midday lull in attentiveness and alertness, usually accompanied traditionally in Spain with a nap in the middle of the day. The phrase siesta is actually borrowed from a Latin term, sexta, meaning six. So originally this was an Italian tradition, not just a Spanish tradition. And in the old Roman days where an hour isn't exactly an hour, the sixth hour of the day, sort of the midday hour, six meaning setta, siesta, is when there was commonly a break in the day, usually after a large midday meal. And in our American culture, we tend to associate siesta time with the Mediterranean cultures, Hispanic cultures, the Latin American cultures. But I think Americans have tended to be more impervious. This is something the rest of the world is attuned to too. So when I lived for half a year in Switzerland, northern part of Switzerland in the 1980s, and the Germans we tend to think of as hardworking and methodical and not taking a rest, would actually shut down banks, shut down schools, shut down businesses for 2 hours in the middle of the day with the expectation that people would go home, have a big meal with family, and take a rest before coming back to work. At least historically, Americans were sort of weird and ignoring this tradition, though probably increasingly with industrialization and computerization and working across multiple time zones, or aspects of modern culture, maybe other cultures are losing part of this siesta time. Assumptions about siesta time is that it's all tied to having a big meal. So the grandiloquent term for this is postprandial somnolence, so after a meal sleepiness. So the claim is that after a big meal in the middle of the day, people would normally be sleepy and get tired and want to take a nap. Particularly some of that postprandial somnolence story or myth comes around now with just after Thanksgiving time, where people eat a big Thanksgiving turkey dinner and then feel sleepy afterwards, supposedly because of high tryptophan levels in the turkey, and tryptophan being a precursor for serotonin, which it is, and serotonin being related to melatonin synthesis, which it is. In terms of the research, it seems that there is some tendency after a big meal to fall asleep. That's any big meal. And that some part of that is that a big meal induces more blood flow to the digestive system. There's activation of the parasympathetic nervous system, which is sort of the dampening down, calming system that's in contrast to our revved up, agitated sympathetic nervous system. Parasympathetic activation seems to happen with any large meals, not just a turkey-rich meal. So one, turkey is rich in tryptophan, but so are all sources of protein. So a lean chicken breast, a pork chop, others are also giving you about 600 milligrams, depending on the serving size of tryptophan. So again, lots of protein-rich meals. There's nothing spectacularly. Turkey is not higher than chicken in tryptophan levels. Cupful of tofu has only slightly less tryptophan in it. The second issue is that eating tryptophan isn't a particularly good way to get it into the brain because of our blood-brain barrier, which screens out lots of bigger molecules. And actually, to get many of the amino acids into the brain, special transport proteins. So to actually boost tryptophan in your brain, you actually need a sophisticated diet, decreasing the amounts of certain competing amino acids to get more tryptophan into the brain. And then the third issue, shortage of tryptophan, isn't what is the rate-limiting step in serotonin synthesis. It's not like the machinery is sitting around waiting for more tryptophan to be shoveled in to make more serotonin. So again, pushing in more of the sort of raw ingredient for the precursor isn't going to make necessarily more serotonin. So we know from studies that human beings have a circadian rhythm in alertness with the big dip at bedtime. So people get tired late at night when they are likely, it's easy to fall asleep readily. Alertness is highest morning, right after you've woken up, easiest to stay awake, hardest to fall asleep again. But there's a secondary lull in alertness right at siesta time. And the research, again, to show that this was an innate circadian rhythm and not just a result of having a big meal, they actually put people on either IV nourishment or were giving them small meals by mouth every hour throughout the day, and they could still see this persistent midday lull and attentiveness happening. So again, it's one of the ways of measuring alertness is to put someone in a dark room with no stimulation, see how many minutes it takes them to fall asleep. Easiest times to fall asleep, late at night, which is normal bedtime, and siesta time. And the siesta time isn't as huge a trough in alertness, but it's there. It's measurable. It's cross-cultural. It is tied to being human beings. So even though that's there, many people, and I'm specifically speaking about many people with ADHD, don't notice any circadian lull in alertness until they're on medications for the first time. I think there's three big reasons to explain this. One is that if your ADD is severe enough that you're being sort of scattered and unproductive throughout the day, then you may not notice a time when you're less alert, less productive, less organized in your thoughts. It may be maybe a little lower, but that's not much lower than your baseline. And being able to be more productive, be more focused, be more consistent in taking care of tasks throughout the morning hours when, again, your innate alertness is higher, that may well be enhanced by the medication, but then you have a higher baseline, which you notice, oh, there's a sudden decrement early in the afternoon. The second factor as to why people with ADHD might not have noticed it is that one thing that's pretty consistently noted, and again, this is the group average, is that overall people with ADHD are less attuned to or less observant of or less able to detect patterns in what their own body is doing. I mean, one of the reasons it's easier to stay up late at night is because it's harder to gauge alertness or sleepiness, the counterpart of this. The second factor just may be what I will call obliviousness. I'm not trying to be insulting. Again, that's something we can physiologically measure. People with ADHD tend to be less aware of when they're hungry, when they're tired. So again, they may have just been blowing through siesta time, midday lull, and it may have really been there. They just may not have been noticing at all. Third big factor, I often notice this with people I've recently started on medication, and others have written about this, because it may simply be an artifact of medication. So we've just start people on immediate release formulations of Adderall or Ritalin, methylphenidate, or dextroamphetamine, amphetamine combinations. If you're starting somewhere 7, 8, 9 in the morning, for many people, their effective life of these drugs is about 6, 7, 8 hours. So you'd expect those drugs to be dropping off right after lunchtime. So that may be a contributing factor to feeling less alert early afternoon. And then the fourth explanation that's often proffered, being on medications may actually help someone with ADHD to be more productive. They may actually be physiologically more tired at siesta time because they've been doing more in their ADHD medicated state than they were doing in their ADHD non-medicated state. But I do think it's important, particularly if someone's only noticing this for the first time when they're on medications, to sort out how big a role of medications have. And one of the simple ways is to be adjusting the timing of when you first take the immediate release. If you're taking it at 6 a.m. some days and 9 a.m. other days, and they're still always feeling less alert at 2 p.m., then that's probably medication not having a large factor. People often start, after finding that the medication's working, if you're sticking with an immediate release formulation, would be to introduce a second pill of immediate release for probably a few hours before this midday lull to avoid or minimize it, and or switching to long-acting forms of a stimulant. So again, even with the long-acting form of the stimulant, even if you are more alert, more focused, more attentive than you would be at all times of the day, we would not expect that to eliminate the circadian rhythm and alertness. You may be performing better overall each time than you would otherwise, but there should still be a dip in performance given our circadian system. So we shouldn't be obliterating all the biological factors of how our brain bodies work. After sorting out if part of it is artificially triggered or exacerbated by medications, then you may want to adjust for that by changes in the medications. Bigger issue is acknowledging that this is a real biological phenomena. In America, we try to minimize what Mother Nature says and power through it, but this is there. So I think acknowledging it is important. Part of acknowledging it may be changing your work schedule. One, making sure that highly detailed tasks or extremely boring tasks either may make you more likely to fall asleep at that time or may have greater implications if you are less alert and miss a detail. So I would schedule those away from this time, the siesta time. Two is it's a good fit for taking a walking break or taking an eating break or just taking a break and not working at this time of the day. Big generalization, particularly for people who have trouble sleeping at night or particularly for going to bed at irregular bedtime. And that's a big factor for many people with ADHD. Minimize daytime napping. That's a overall rule or recommendation. There's two big factors determining the likelihood for sleep. Again, one is a circadian rhythm factor, which peaks at nighttime, peaks again a smaller peak at siesta time, but there's a fatigue factor as well. And the fatigue factor is directly tied. How long has it been since you have a period of sleep? A short nap shouldn't eliminate completely this fatigue factor, but it does diminish it. A longer enough nap will completely take out the fatigue factor as one of the two big factors for sleeping at nighttime. A daytime nap can make it more difficult to fall asleep at night. Most of the sleep experts would say a nap in the range of 20 minutes to maybe even up to an hour in the midday may be acceptable and may be not diminishing nighttime sleep propensity enough. And again, some of this is done by a limited amount of study and research. So nobody has sat and said, let's look at a 20-minute nap versus a 40-minute nap versus a 60-minute nap versus a 2-hour nap versus a 3-hour nap. We extrapolated from a few data points. So if a nap really works for you, keeping it short in the order of 20 to 60 minutes may help you get through some of this daytime lull and siesta time. Trying to ignore it completely or pretend it isn't there is going to be working against your own biology. I don't recommend that. So that's about all I'm going to say for siesta time. I'm not seeing any question. Be safe, be sane, have a good week.